American Pie. And I'm sorry that I've been away so long, but today we have two special guests. And with these two special guests and myself, we're going to try to inform the viewers about issues surrounding healthcare, FDA, nutrition as a whole, and some of the things that you can do for a good quality of life. We know that living in America is not all about economic and social issues. It's all about current events. And one of the current events that's going on right now is healthcare. And it's in the Supreme Court right now, and a possibility we might lose Obamacare. So if that be the case, we want to inform you of some of the things that you can do. The healthcare is a very complex issue, and we want to share some of our views with you with a basic open discussion. And to my right, we have two distinguished gentlemen, and the one that's nearer to me is Tyrone Feltus-Carey. Welcome to the show, Tyrone.
Thank you, James.
Okay. And we have also Mr. Anthony Mitchell. Welcome to the show, Anthony.
Thank you, James.
And we'll start this discussion off with everyday talk. And one of the things that I'm curious about and interested in is the fact that I've known these two gentlemen for a long period of time, and I have a lot of respect for them. And they are information gatherers and very spiritual people. So when they come to me about something of interest, I'm already sold. And Anthony, I'd like to start with you. Can you tell me a little bit about your background?
Sure. I've been in Vallejo for approximately about 20 years. Used to be a professional basketball in Europe. Decided I really needed to be a father to my two sons here. So I came home, became a school teacher, teaching high school and elementary school and junior high. But from that, I actually went into my own business because I realized that, the teaching profession is a great profession, but you know what? You don't always make a whole lot of money. So in starting my own business and becoming independent, I got into the health industry because I was looking at what was going on in my household and really in the economy today.
Great. And Mr. Carey, how are you doing today?
I'm great.
Can you tell me a little bit about your background? Some of it I know, but could you share with the public?
Sure. I've been a resident of Vallejo since 1998. In the last, about midway through 2009, I started looking at what I was doing professionally. I've been in the financial services industry about 30 years. And my confidence and in the financial service industry and the retail products I've been marketing over the years began to wane substantially. As everyone knows now, it's been a big challenge for people. And so I started looking at some other considerations, how I really wanted to spend my final years working and what area I could get a passion about. And personally, I started focusing on my own health care and my own physical status health-wise. And I started talking to my doctors, looking at questioning things I could do to better improve and sustain a high quality of health for myself. And the more I looked into it, the more I got interested in and discovered the big challenge and the number of health challenges that continue to grow. And so that's what led me to get into the nutrition industry and take a look at what kinds of things are available that the public needed to know and that I discovered that would help me sustain quality of health care and life.
Yeah, I know that me and Mr. Carey, we had a discussion at Panama Reds down at Vallejo waterfront. It was a beautiful day that day, and we were talking about healthcare, and a gentleman came in and chimed in on us because he was interested in the discussion we had. But healthcare in itself, we all have different perspectives about healthcare, and the fact that it's in the Supreme Court now it really just took effect. It's on the verge of possibly being thrown out. But we know from our discussion and Mr. Carey's discussion that it is a complex situation. And so your view of what you hear, Mr. Mitchell, on a regular basis, what are your concerns about health care and what's taking place with Obamacare, whether it be the Supreme Court, whether it be the influence that the financial Wall Street or the bankers have on our politicians, or just the interaction or transformational change that has not taken place between Republicans and Democrats on health care? Do you feel that your needs are being met?
Well, I'm an independent business owner, so you know, we're self-employed, so we don't really have anybody paying for our own. We have to pay for ourselves out of our own pocket. So I think, you know, making it affordable is always key.
Okay.
You know, you have to have something that's affordable that the everyday individual, working individual, can be able to tap into.
And you, Mr. Carey, how do you feel about health care? As far as, do you think that you have the access you need for health care? Is it affordable to you? Is it accessible? And if you have coverage and you're paying for it, does it provide for you that you have a sense of security for short-term or long-term illness? Do you feel that you can walk in and get the care that you need?
Well, that's a complex question. First and foremost, as everybody knows and is aware, that medical and healthcare is rising. The cost is rising faster than our incomes and our pay raises. So that in and of itself presents a major challenge for most people. Being a independent business owner and working on my own, certainly you have to have concern for employees and assistants and people that you have responsibility to assist in making sure those provisions and benefits are available to them. So cost is a major factor, and availability of it. As I said, as I move closer towards the retirement years and start looking at things like Medicare and Medicaid and how the whole provisions for health care are and how they've changed, they're complex, even just to understand them.
Yeah.
So I think one of the most important things that we need to be aware of and need to accomplish is education about our choices. Education about even how we want to vote and give a communication to our politicians in terms of how to best represent us and our needs.
The reason why I bring that into focus and get both of your opinion is because the fact that it is about access, it is about cost, and how much security do we feel for those who are making decisions about us. And is it a responsibility of the government? That's one opposition, to be able to, say, put health care into place. The other opposition says that the government is too big and that they shouldn't have the right to impose mandatory health care. But yet at the same time, a large number, percentage-wise, the consensus on surveys said that the American people want universal health care. The complexity of that comes down to money and how much information do we have. Even the professionals that we entrust, the politicians that we entrust, the complexity, they don't have the answers. And what we hope to bring about is people to become aware and alert to where they want to research and possibly be proactive in all aspects when it comes to their needs. And healthcare is very important because if you can't get access, you can't afford it. It really comes down to how much time do you got on this earth and the quality of life you have. The fact that the role that the FDA played, I bring the FDA into the Federal Drug Administration. I feel personally that they have our best interests at hand, and they're going to not let anything onto the market, whether it's medication or supplements, that will be harmful to us. Now, I might be naive because we have seen where they have had major recalls, whether it be medication, prescription drugs, or supplements, or whether it's food and contaminated food, E. coli in fast food chains, or stuff that you buy at different stores, Costco, or your local supermarket. A lot of people feel like I do, the FDA got it covered. But Tyrone, do you think the FDA is effective, or they have success and failures as well?
Well, I think certainly as a department of our government, they have successes and failures. Again, I think it's an area, even in discussing the FDA, where most of the public have not been educated on their role, their responsibility, the areas that they cover, the areas that aren't covered by them, and who is accountable and responsible for regulating and covering those areas. So to me, it goes back to getting that education and getting that clarity so that we can have an appropriate opinion that's in line with what's reality and what's not in terms of our expectations.
Yeah, I like that answer. And as I promised, you know, if I ask you a question, I'm not going to leave you hanging, but that was a great answer. The FDA has had success and failures, and one of the reasons why the FDA came into effect was one of the main issues of cosmetic treatment for breast implants. Women were dying and being scarred and mutilated with long-term illness that led to death from the body rejecting silicone implants. And today, women are still getting these implants. And the FDA, for Federal Drug Administration, was successful in bringing out a protocol, but I'm like many people saying, you know, why do it? Why are cigarettes on the market? You know they cause cancers. Is labeling sufficient enough, knowing what's ingredients in it, and that it can cause death, and we'll just raise the price on it? Is that the role that we want government to play, or do we want a more systemic long-term role is to eliminate it altogether when you look at drugs and if they cause death? But we live in a democracy, right? What's your perspective on that? Things that can cause death to us that we can just go in and buy because we have the money. How do you feel about that? Well,
you know, we say we have freedom of choice, right? You know, but it's also that awareness of what you're choosing. We always say one thing is, you know, health is wealth. If you don't have your health, you really don't have anything. Would you agree?
I agree.
So it's making somebody aware of, you know, as we see the advertisements, the infomercials are talking about, you know, side effects of specific products that are on the market today, you're aware. Yeah. So sometimes you go in and you know what you're getting involved with only because the FDA has regulated and the government has set a standard to at least educate you on something. But you also have to do your personal education. You got to take some time out, because whatever you intake, you know, whatever you're going to do with your body, it's your body. You know, and the responsibility a lot of times falls back into our own households, how we manage our households, you know, husband and wives, and what you're doing for your children. That's very important, you know, to get you on the right track. But that awareness is very key.
And to say the FDA, its success and failures, food compliance program, labeling guides, and other guidance documents to inform the citizens, American citizens. It also works to reduce the risk of criminal or terrorist actions on the food supply, which is a very new concept for the FDA. They're having a summit on the 17th of this month. It's a webinar. So you can actually go to www.fda.gov, and there's a direct link to that. And it's a food and safety summit workshop, of interactive food defense workshop. So you can actually chime in onto that between 1 and 5 p.m. Eastern time. The labeling requirements is another one for food under the Federal Food, Drug, and Cosmetic Act. The nutrition. Mr. Carey, nutrition. What does nutrition mean to you?
Nutrition to me means the intake of the proper vitamins, minerals, and food to help bring the nourishment and the energy and fuel that your body needs to sustain itself and to maintain a high quality of functionality.
And Mr. Mitchell, nutrition, how do you find nutrition?
I find nutrition, well, my wife being a chiropractor and us doing, you know, holistic things, I find nutrition as a key, you know, to really better your life. Many times we don't even realize what's available to us nutrition-wise, you know, supplements. What we intake, because our food is so nutrient depleted today, you're going to have to substitute something in your diet today just to make yourself, Some sort of supplement. I mean, you see so many multivitamins and GNC stores around the market. You know, when I found a nutrition that I believe, you know, has really changed individuals' lives. I mean, a nutritional product called Moringa oleifera that, you know, it's got 46 antioxidants, it's got 36 anti-inflammatories, all of your omegas, your 3, your 6, your 9, and 20 amino acids. Now, when you find a plant or you find a supplement that has those nutritional capabilities, many times what do we have problems with is inflammation in our body. Maybe because of something we've eaten.
It's a rejection,
you know,
of some sort. Your
right.
body talking to you, telling that this is not.
So your body's saying, I didn't get the proper nutrient that I needed. And many times it can be for breakfast. It could have been what you ate at lunch, what you eat at dinner. And when you don't give your body the proper nutrition, you're going to have some type of issue later on. But if you can find something that's going to give your body the proper nutrition, then you can get on track. I mean, me talking about me being a school teacher, many times I saw the kids coming to school and not having ate a proper breakfast or even a nutritional breakfast. Many times your body's not always craving food, it's craving the proper nutrition so it can function at its optimal level.
Now, nutrition, you were an athlete.
Yes.
Basketball player, right?
Yes.
A very good one at that. And when your body wasn't balanced with the proper diet, did you feel like you were toxic or you were out of balance, sluggish? Were there symptoms that showed that, you know, you weren't at your peak when you tried to perform? Oh,
absolutely. Many times you're out of balance. You know, if you haven't eaten the right, you cannot perform at optimal level. You know, especially, you know, exerting so much energy at one time. If you don't have the proper nutrition, then you're lacking something. You're even lacking focus. And if we're trying to focus and accomplish, you know, or more or less we call it getting into a zone, if you're trying to be in that zone, you have to have the proper nutrition to help you get there. You got to understand, you know, combining with the rest and all of that. But if you haven't eaten properly, there's no way I could go out, you know, and drink a whole lot or smoke or something like that you were talking about earlier and me be successful.
That's right. Mr. Carey, I know you have a spiritual background. And when you talk about nutrition, is there a balance not only of good eating, exercise, is there a spiritual component to that? You know, because I know when I'm not eating right or I'm put a lot of overate, especially when it's not the right stuff, I feel bad about myself, you know, knowing that, you know, I have this addiction to certain foods like cheeseburgers with bacon, you know, jalapenos on it too. And then after I've really thoroughly enjoyed, but when I'm finished with it, I feel like I've actually sinned, you know. Spiritually, like I'm not in tune. And it bothers me. And, you know, I'll exercise or walk it off, but I'll do it again. And that spiritual imbalance, I guess, is set off by my addiction to whatever I like to eat. So in this nutrition, are they putting stuff in our food to make us addicted to it? Can I throw that blame on them and not be accountable or responsible for what I put into my body in some sense?
Was that a question to me or?
The spiritual aspect of knowing that I've done wrong and I'm not being responsible or accountable. Does it spiritually affect us if we go on and on eating because we know different and we still indulge in that pattern? Because medicine, one of the key components about healthy is being knowledgeable to act on prevention, knowing that this is not the right thing to do. This is the right thing to do.
Well, as a believer of the scriptures, being our instruction book, if you will, for how to live a quality of life, you know, we're instructed to be good stewards of our physical bodies. And for me, what I've discovered is that I didn't know enough about how this body is designed and how it functions. So how can I be a good steward of something I've been given charge and responsibility over if I don't know how it works? So to me, from a spiritual standpoint or scriptural standpoint, it's important for us to know. It's our responsibility, our accountability to understand, take the time, get the information, the disclosure, the training, and the educational background so we can be better stewards of that. You know, the body is designed to function a certain way, just like a car engine is designed. So when you take your car in, or when you get a car, you get a manual. This is how it works. And if you divert or do things to the car, put the wrong kind of fuel in it, put water in it instead of oil, it's not going to function. So it's the same thing about our bodies. If you compare it to a machine, if you put the wrong kinds of things in there by your food intake, or not adequate things in there, then your body's not going to function and operate at its optimal level, and you're going to have problems. You know, and what it adds, at the end of the day, what it comes down to is that it impacts the longevity and the quality of life.
This moringa plant, that's the correct pronunciation?
Moringa, yes, sir.
It's also known as a miracle plant.
Yeah, miracle tree.
Yeah.
There's a book called The Miracle Tree, written by Dr. Monica Marcoux, who's a PhD pharmacologist. And she talks about moringa as maybe being one of the most perfect food source that's out there. And because what it contains by itself, I mean, it has 4 times the calcium of milk, 4 times the vitamin A's of carrots, 2 times that of the proteins of yogurt, 3 times the potassium of bananas, and 7 times the vitamin C of oranges. So the plant itself, Moringa oleifera, is something that I believe that God made for us, and really helping us get back to balance. As he's talking about energy and all of that, we have almost, you know, it's the most nutrient-rich botanical, was actually voted as Plant of the Year, March 21st, 2008. Johns Hopkins University, you know, actually states how moringa can help over 300 different diseases. Now, as you say with FDA, we're not saying that we cure, we treat, or we diagnose anything, but it can help you feel, you know, much better by getting the proper nutrition in your body. You know, if you give your body the proper nutrition, it can self-correct. And many times that's what you're lacking, you know. Not having the proper nutrition, you're not going to get it necessarily from eating, you know, the fast foods or all of those different places.
Can I go take a hike on Mount Tam and find this plant? Where is it from, and how many different countries is it? Can be found in? It's
actually grown in about 82 different countries, and there is 52 different strands of Moringa oleifera. So, I mean, very potent. I mean, you know, here in Vallejo, we have a large Filipino community. They've actually have eaten moringa most of their life. They actually call it malunggay. You know, and they've eaten it all their lives. You know, that's what they've kind of grown up. It's been a staple that they put in their soups, their salads. You can get it at the farmer's market. But there's different strands, so there's different levels of potency between each strands. Because the malunggay that's grown in the Philippines is different from where we get it in Africa and India, because it's grown around water. And water makes it, you know, easily salatable, and it's not as potent as it does in a dry and arid place where we get it from Africa and India.
Mr. Carey, when we were talking at Panama Red, when we go to the doctor, we brought up a very interesting point, is when we go to the doctor, we usually talk about our symptom and what's ailing us. Very seldom do the doctor ask what our diet is, okay? And do you feel we have to know more than the doctor? Or do they know exactly what they're doing?
Well, I wouldn't make a statement whether, in general, doctors know what they're doing or not. I mean, they've gone through a tremendous amount of education and training and preparation. I think the challenge lies in the individual doing some research and discovery for themselves, both about nutrition, how the body functions, what kind of appropriate fuel intake that they need. There's been studies and research and information about different body types, you know, different lifestyles. Some people live more stressful lives than others. Do we have access to food products that are grown in an organic or less exposure to toxins, and the things that they put on food. I just think that, as you spoke earlier, the disclosure is not adequate. When I had a discussion with my doctors, they gave me generic answers about what I should be doing to sustain and improve my quality of life and my physical health. They're just generic answers, and I felt that I needed more specific things to do, because I'm aware, as the general public is, that you shouldn't eat too much salt, not too much sugar, low-fat diet. I mean, that's general information right now. But I was looking for something more specific and unique to dealing with, my health challenges, my health status, and moving forward.
And we know that from discussing the overall model of what American doctors use to treat American citizens is a symptomatic model, that they treat the symptoms and not really treat the cure, look for the cure. And they use a lot of prescription and pharmaceutical drugs, where in other countries they use the herbal approach, meditation, of course fitness as well, and ancestral home remedies. Well, this is the end of our show, and I'd like to thank you, Mr. Carey, for being on the show.
Thank you for having me.
Mr. Mitchell.
Thank you.
Thank you for being on the show. And we hope that you enjoyed this segment of American Pie, trying to alert you and inform you of healthcare, as well as the responsibility and accountability of the FDA and how important nutrition is, and to arm and alert yourself, put more tools in your bag to ask the proper questions that might lead to a long quality life. You can also go to www.fda.gov as well as www.tmc.gov, TCM, for more information and direct links to the summit for the FDA that I talked about, Food Summit for its terrorist national security. Thank you once again for being and viewing in on American Pie. And I thank my guests once again. Hey, guys.